Hey guys, Dr. McClimon back with McClimon Chiropractic, and today we're going to talk about how to eliminate knee pain for good. There's different reasons that we get knee pain. It could be a sprain strain, it could be osteoarthritis, it could be a tear in a ligament. But one of the most common things that we see that we actually help with, if you tear a ligament, you got to go see ortho. But in our specific situation, the thing that we see that often gets overlooked and doesn't get helped are two things. One is called subluxation, where the actual knee joint can shift and that causes irritation within the knee. The second one is when we see an actual imbalance in the pelvis. When the pelvis actually shifts, the femur, the upper leg bone, will rotate, which means the lower leg bone rotates, and it creates torque and stress on the knee, which causes knee pain. To have a pelvic imbalance, it comes from one of two reasons. One is, actually three, but one is you actually have a short leg, so one leg's actually shorter than the other. The other is which can come from one thing. It could be congenital, or it can come from a prosthetic, like you had a knee or a hip replacement, which changed your leg length. The other one is actual subluxation, where the pelvis can shift, it can drop, and it creates an imbalance in the mechanics of the structure, creating knee pain. So today we're going to talk about just that and how we help that. So you can see in this picture here, this is a person that has had their hip replaced, and due to that, they actually have an imbalance in their pelvis of about 24 millimeters. That's an anatomical difference, and we could tell that through our exam process and through the x-ray. So an adjustment isn't going to fix that, but that's going to create a big torque in the pelvis, a torque in the leg and the knee, and often create knee pain, okay? Not to mention back pain. So how do we fix that? Well, an adjustment's not going to fix it because it's anatomical. So we have to fix it with either a lift in the shoe or an orthotic. So in this case, we will use just that. We'll put a lift in the shoe. Eventually we can make an orthotic that goes into the shoe, which balances the pelvis, addresses the anatomical difference, improves the mechanics and alignment of the tibia, the femur, and the pelvis, eliminating the irritation, the inflammation, and the knee pain. That's addressing the root cause of the problem, which oftentimes gets overlooked. The other reason, so prosthetic can create deficiency. The other reason that we often see an imbalance in the pelvis is because one leg's actually shorter than the other. It's just congenital, okay? So in this person, you can see we have a 28 millimeter deficiency here, okay? This is the same patient. This is after we put the orthotic in the shoe, and you can see the difference in the structure. This is going to create a lot less knee pain, a lot less hip pain, and a lot less back pain, and a lot less arthritis, because you don't get arthritis because you're old, you get it because you have old misalignment. So improving that structure, which has to be done with a prosthetic when it's anatomical, helps to improve the structure, decrease inflammation, and decrease the knee pain. So guys, that's one approach that we take to improve knee pain that's not addressed outside of chiropractic and different and addresses the root cause of the problem. So hope that helps. If you're suffering with knee pain, you don't have a tear, you don't have osteoarthritis, and it's not a sprain strain, it could be from this. If you haven't had it checked, be happy to check you and help you out. God bless.